This is another case of bone relation class 3. What do we mean once more by bone relation class 3? The mandible is protruded to the front. This is the patient in RCP. You find that the mandible is advanced in position in comparison with the maxilla. This is a class 3. This is a bit more severe than another video that I've recorded for class 3. We talked about incisal camouflage and slightly about the molar camouflage, but there only incisal camouflage was done. Today we're going to talk about molar camouflage. So why is class 3 a problem? Because once the patient has a lot of resorption, the bone now is in the wide area of the mandible, not the narrow area. We remember that the teeth were somewhere here, more lingual here. But once the resorption goes down, the body of the mandible is wider from the area where the teeth were present. So we're going closer to the wide area. That means there is a horizontal discrepancy between the small maxilla and the large mandible. Okay? If I want to follow this in setting, what I'll have to set the molar teeth very far away from the ridge. The functional cusp will not be over the crest of the ridge. And what will happen is this denture will flex and even will be biting on the cheek. This is not practical. So there is a horizontal discrepancy between the size of the maxilla and the size of the mandible. In the other video, we concentrated on the camouflage done in the incisal area. In this case, the technician had done further adjustments and they done camouflage in the molar area and camouflage in the number of the teeth. These are the modifications we do in setting in cases of class 3 bone relation. So if we look at the upper setting, this is the upper base plate. We find that the number of teeth is reduced. They have taken out one premolar. Why? Because when the mandible is going to the front, more to the front, that means we have a shorter arch here, even if we set all teeth, because it's advanced. So they remove one of the premolars from the upper. This is one of the modifications in setting for class 3 patients. The second modification is reversing the overjet. The reversing of the overjet, if there's mild class 3, we do a single or unilateral crossbite. But in this case, this is a bit more severe class 3. We were able to do the camouflage by the teeth, proclination of the upper, retroclination slightly of the lower, and we got the class 1 relation in overjet and overbite. This will aid us in having the S sound and the S sound perfectly. But look posteriorly, they had to produce a crossbite. So they set the lower teeth more buccal than the upper teeth to solve the problem of the wide mandible. In some cases where this is a severe case, in some cases that are moderate, only unilateral crossbites are sufficient. In other cases that are mild class 3, we only satisfy ourselves with the anterior setting, the camouflage anteriorly. But here we have bilateral in the premolar up to here. It's like a scissor bite, and then it's a cross bite in the distal molar areas. Okay. This is a scissor bite where the cusp is meeting the cusp, but actually it's in the space in between two cusps. But actually the cusp is in the same level of the other cusps. Okay. Then they move to the reversed bite in the molar teeth. So these are the modifications in bone relation class 3. Thank you.